Finance Minister Nirmala Sitharaman is speaking in the Lok Sabha. Let's listen into what the Finance Minister is saying on the floor of the House.
The MSME category, even though they have the capacity, even though they have every strength, but even in the last budget, we expanded the definition of MSME so that even if they go beyond a certain level in their turnover, they'll still be defined as MSME. They don't lose out on their benefits. But this budget, we've taken that a bit further and very clearly announced ways in which such medium-sized industries which have potential to grow and export and also become champions in their sectors can be given further help, and I've announced several steps towards equity help, professional help, and also making sure that they will have liquidity access. And in the process of 3 ways in which we want to reach them, we are giving them the support which, even if they grow out of the turnover limit, which defines them as an MSME, they will be leaders in their sectors so that they can participate in India's growth. Is this only for industries? And is it not going to concentrate, is this budget not going to concentrate on building manpower so that our youth can aspire in a particular sphere of activity to go with skills in his hand or her hand and achieve jobs or become entrepreneurs themselves? In this, I would like to highlight 2 major announcements that we've made, in which I have not named any states. In fact, I have openly said, for creating this big facility, states can aspire, any state can aspire, going through the PM Gati Shakti filters. If you think you have a proposition in your hand, any state can ask for one of the 5 that I've announced in terms of the allied and health service, where we want to set up medical hubs. States can aspire to be a part of it, wherein all the aspects of medical education and hospitals for treatment of patients can all be focused in one area, where nurses or any other 10 different allied health services will have their institutions through which people can learn, get themselves skilled, find jobs there itself, and that will become a medical tourism hub. So any state can qualify, and I'm sure states which have traditional strength can also be coming in for it. And this includes Ayush as well. So this is a major forward-looking proposition wherein immediately, because of the medical tourism advantage that India has, this will become a center of multi-purpose, multi-speciality, allied health service center through which we can promote medical health, medical tourism. So that was one of the major announcements. Similarly, we have said, instead of waiting to qualify and finishing your education and coming out and seeking where should they go for acquiring skills, the skilling element can be brought into education itself, and at the end of the day, when they come out, students can say, I can become entrepreneur, and this kind of a mega center can be kept next to any industrial cluster that any state has. So these mega entrepreneurship building centers as education hubs can also be coming up from any state. We are willing to work with the states so that this mammoth higher education center can be propped up, and therefore students can go there, come out as entrepreneurs, get to doing businesses. So if we've done these 2 in the major education-related activity, health-related activity, we've also openly said that mega textile parks, we are willing to work with states, particularly looking at industrial textiles, looking at textiles which are going to be new age, which are now becoming a part of manufacturing in industries, whether they manufacture a car, where the safety cushion which comes in is all completely made out of industrial textiles. So these kind of new age textile requirements can also be produced. So these are major announcements, and I welcome any state which wants to come into this area. the center is willing to work with them and promote it. If this is all being done at the level of youth and students and larger centers where jobs and education can go together, health and education can go together, health and providing services to patients who come from different parts of the world come together. We are also placing emphasis in animal husbandry, fisheries, to make sure that in every district you get the facilities for a veterinary surgeon, veterinary hospital, testing labs, so that animal husbandry can be given that priority immediately in the rural areas. So farmers or those who are not farmers who want to get into animal husbandry can also benefit. That is why these announcements for fishing sector, it goes along with money being put in for restoring 500 Amrit Sarovars, the waterways, and the particular waterway which has been, national waterway which has been announced, also has institutions of excellence along its course, along the course of the river, so that shipbuilding, boat building, particularly I mentioned this, the route in which the national waterway is being announced, which will end up covering all the mineral-rich parts of the country and linking up with Paradip or with Dhamra port, is passing through states where the Nishad log can become boat makers, and they're already experts in it. They can also teach people. They can become part of the Institute of Excellence, so that inland shipbuilding for the transporting of huge logistical facilities will all have the support of the local experts who for generations have done this work. They can also benefit in this growth. Equally, ma'am, as I said, not just helping the MSMEs which are new, but also the old and legacy industries, 200 legacy clusters which have been known for decades as those places which supported MSME, and from there they produce and export. It can be any of them. It can be Ludhiana, it can be Jalandhar, or it can be Kanpur, or it can be centers near Bihar, it can be anywhere in Bengal. So any legacy cluster, 200, we have volunteered that it can be funded, upgraded, given the modern instruments, hardware, software that is required, we'll be undertaking that. Other than also providing for girls' hostel in every district, so that girls do not hesitate to take up to science education, which requires long-term, long hours to be spent in the colleges and universities.